Okay, moving on to osteoarthritis management. So let's say you've gotten through the puppy years, you followed all of those recommendations, and hopefully your pet doesn't have arthritis. But if they do have an injury or have developed some sort of a change in their joint, then we need to know about how to address that. And what we know is osteoarthritis is a degenerative joint disease. It's chronic, it's painful, it's inflammatory, and it affects a lot of tissues, not just the cartilage, but also the bone under the cartilage, the synovial membrane, so the inside layer of the joint capsule, and all of the tissues that surround the joint. And what happens is it leads to immobility and actually can really reduce the quality of life in our dog patients. We know that 20% of dogs spontaneously develop osteoarthritis, just secondary to age. And that equals about 15 million dogs in just the United States alone. And we also know that large breed dogs are more commonly affected by osteoarthritis. And I suspect it's because of all of those developmental orthopedic conditions that they're more predisposed to. Also, dogs that are overweight, dogs that are underexercised, dogs that have had injury, older dogs definitely have a much higher chance of developing osteoarthritis. So I have this whole list, and I've kind of alluded to a lot of these things when I talked about treatments for some of those conditions earlier. But what we do when we have osteoarthritis is we take what's called a multimodal approach, meaning we use we come at arthritis from multiple directions because it's not really safe just to put the dog on one drug and hope that it works and um, never look at other options. So, and by safe, I mean, because osteoarthritis is progressive, if you start a dog on one medication and just hope that it's going to work for the rest of that dog's life, it's not going to. So then we might be tempted to maybe take that dosage up a little bit on that drug, which will then increase risk of side effects. So if we try to maybe come from different angles, then the chances of side effects are going to be much lower and it's going to be safer long term for those pets. So let's start off with medications. We've got a lot of options. Basically, the foundation for osteoarthritis is an anti-inflammatory. Like I mentioned earlier, osteoarthritis is an inflammatory condition of the joint, so we want to reduce that inflammation as much as possible. And I'm sure many of you have heard about Rimadyl, the generic name is carprofen, Deramax, Previcox, Meloxicam. You probably have had a pet on one of these medications. They all work pretty similarly in that they block the inflammatory cascade. So when inflammation happens, it sets off this whole cascade of like a chain reaction of events. And what NSAIDs do is they block that cascade at a certain point and stop the inflammation. Now, Galliprant is a newer NSAID. It has a little bit different mechanism of action. It actually binds to one cell receptor to reduce inflammation and pain. And because of that, it theoretically, because it's so targeted, has less side effects. I clinically have seen in some pets that it is less likely to cause GI upset. So maybe I've got a dog who I tried Rimadyl on and they had some GI upset, maybe loss of appetite, or maybe some soft stool, or maybe even some blood in the stool. And so we decided, let's give the dog a break for a little bit. And then we tried the dog on Galliprant and they did well with that. What I want to caution you against is when it was kind of rolled out to veterinarians, because it has such a targeted mechanism of action, it was implied that this drug is safer for maybe an older dog, maybe a dog that's got kidney issues. The problem with that is there's no data to prove that, at least not as of yet. So, just because a dog has, say, mild kidney disease, doesn't necessarily mean that Galliprant's going to be the better option for pain relief. So have a discussion with your veterinarian about that. But I have had great success with Galliprant, working for, these chronic osteoarthritic patients. Now, my foundation for osteoarthritis patients, if they can tolerate it, are NSAIDs. And then I'll add either gabapentin or amantadine. I like both. And gabapentin basically is an inhibitory neurotransmitter. So what it does is it blocks the central nervous system's pain perception. It kind of dampens down the pain response. And, gabapentin helps a lot of dogs. One thing that, because it's an inhibitory neurotransmitter, it can cause lethargy in especially senior pets. It can cause drowsiness. They usually kind of, after they've been on it for a few days, they kind of overcome that drowsiness. But it can be kind of startling to pet owners when they're started on gabapentin. So what I typically do is start them on a low dose and gradually increase the dose and the dosing frequency, to basically find out where's that point where it's helping that NSAID in controlling pain relief, but it's not so much that they're just kind of a lump laying on the floor. We want them to still be active and go about their normal daily activity. Amantadine is another what I call adjuvant medication. It helps to block the pain signals from the spinal cord to the brain. So it blocks receptors. So it again reduces pain sensation for these osteoarthritic dogs. And there's actually more data behind amantadine than gabapentin, but I think gabapentin probably is used more commonly in veterinary practices. Now, you could use a steroid. You would never want to use a steroid and an NSAID at the same time. That is a big no-no. They stack those in people all the time, but in dogs, we never, ever, 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 ever want to give something like Rimadyl and prednisone at the same time. And the reason behind that is they both increase the risk of gastric ulcers just by themselves. And then if you give them both at the same time, that risk of gastric ulceration goes sky high, and the dog can quickly develop bloody stool and die. So it's not something we want to do. If for some reason the NSAID itself isn't working well, then we can always take them off an NSAID and switch to a steroid, which has a much stronger anti-inflammatory effect. But we are always concerned about using steroids because of the side effects. So if you've ever been on a steroid yourself or ever had to give a pet a steroid, it makes you thirsty, it makes you hungry, it makes pets pant. They sometimes have urinary accidents because they're drinking so much. So it's not really desirable to keep a pet on a steroid long term. It also sets them up for a risk of metabolic problems, endocrine problems. So it's not something that I would suggest if we can really avoid it. Codeine is an opioid. It definitely helps to block pain, but it doesn't really do anything for the inflammation. So it's more like a Band-Aid. So it's not really taking care of the underlying problem. I'll use codeine occasionally if I have a pet who can't tolerate an NSAID. The NSAID is causing GI upset. Not a ton of data on using codeine in dogs, but it is something that I've used and had success on select cases. Tramadol. Tramadol used to be a drug that I prescribed very commonly for my osteoarthritis dogs. And the thought was that it worked kind of like an opioid. It was like an opioid. It's the way that it's metabolized in people is it works similarly to morphine. And what we found out, though, is that tramadol, when it's metabolized in dogs, it is not metabolized to the active metabolite, the morphine-like metabolite, like it is in people. About 20% of dogs actually metabolize it to that metabolite. So for those 20%, it does act as a pain reliever. But for the remaining 80%, it actually works along some of the anti-anxiety, like serotonin uptake inhibitors, norepinephrine pathways. So it works more as like an anti-anxiety, which if you have a pet who's in chronic pain, and you provide them, some anxiety relief, they're going to rest better. They're going to feel better. So clinically to the pet owner, they're going to look better. But these studies that there's a recent study back in 2018 that looked at its actual ability to control pain, and it really does not control pain better than even a placebo. So my personal stance is, if the benefit of tramadol is more based on its anti-anxiety function and it's not really relieving pain, then I would personally rather prescribe an anti-anxiety medication and not prescribe tramadol, which unfortunately is a known drug to be diverted and be sold to drug seekers. Um, so it's not a product that I prescribe at all anymore. If a pet comes to me on tramadol, I try to get them off ASAP, and we look at other options. So another pain relieving option would be to do joint injections. So that would be injecting a joint with, we have a few options of things to inject to the joint. What's nice about a joint injection is we're treating just the joint. The oral medications have to be taken in by mouth, absorbed, metabolized, and then it gets to the joint, but also can have effects on, the organs as it's being metabolized. Whereas joint injections, we put it right in the joint, right where it needs to go. So one thing that I commonly inject into joints is what's called platelet-rich plasma, or PRP. Platelet-rich plasma is basically, we draw blood from a pet. I have a special centrifuge that I put the blood in, and it spins and separates the blood into different layers. And basically, we condense that blood to a very highly concentrated amount of platelets, and it's in a very small amount of fluids. And the platelets, what we know is that they have a lot of functions. You've probably heard of platelets in regards to how they help with blood clotting, but we also know that platelets are basically full of growth hormones, which helps tissues to heal, it helps with inflammation, and it helps reduce pain. And so if we can draw blood from a pet and inject it, purify it, condense it down to high concentration of platelets, and inject that into a joint that has inflammation, what we have seen is that it reduces inflammation and pain in these joints, and oftentimes reduces the need for something like an NSAID. And I've had pets do really clinically well. There are several studies out here looking at PRP as an option. The problem with the studies is they don't have huge pet populations in the study, and they don't look at things long term. So we still need more data to really tell us what to expect long term with something like PRP. It's also called regenerative medicine, which I think is a bit of a misnomer, because I think that when you say regenerative, you think, oh, it's basically making that joint brand new again, and that is definitely not what's happening. I cannot tell you that PRP is going to, restore the joint back to how it was before arthritis developed. We know for a fact that there's nothing that will make new cartilage. Once cartilage is gone, it's gone forever. So if you read about any supplement or any miracle drug, any miracle anything that says, oh, it restores cartilage, run away from it, because it's not accurate. But what we do know is PRP can help reduce inflammation and reduce pain. And I've had many pets who we do an injection into the joint, and they get months of pain relief without having to take daily oral meds. So it's something to consider. There's also a product called autologous protein solution, which is basically PRP with additional additives that further reduce inflammation, and it's got good data behind it. I typically use PRP in younger patients with less severe osteoarthritis. if I've got a 13-year-old Labrador with terrible elbows, I'm not most likely going to use PRP. I'm probably going to be looking more at steroid into the joint. And I typically add hyaluronic acid, which is a joint lubricant, to those injections. Actually, I add it to the PRP and the steroid injection. And my thought process behind that is, if I've got a young dog, who has good functioning platelets and their joints aren't in stage, then the likelihood of PRP being beneficial is good. Whereas an older dog with end-stage joints, maybe those platelets aren't working quite as well, and I don't want to spend quite a bit of money and put something in that joint that may not work as well. So I talk to the clients about which is going to be the better of the two options for their pets. But there are options and something to consider if you have a pet who can't tolerate oral medications, or you're looking more at a holistic option with something like the PRP. So when I talk about joint support, there's really only one product that has any data to prove that it can slow down the progression of osteoarthritis, and that's Adequan. Adequan was originally used in racing horses to try to extend their racing lifetime. And they formulated a canine version. And I have been using Adequan for probably 20 years. And it is something that I really recommend for really any patient that has even the first bit of osteoarthritis. It's best if given earlier in the course of disease. So what Adequan is a polysulfated glycosaminoglycan. And what it's been shown to do is actually slow down the progression of osteoarthritis. The way that it works, we're not, you're probably catching the theme. Sometimes we don't really understand the way things work, but we know that basically it blocks the enzymes in the joint that degrade the cartilage. So it slows down degradation of cartilage. It improves the health of the existing cartilage. Does not make new cartilage, but it improves the health of the existing cartilage. And it relieves pain by reducing inflammation. Big picture is it slows the progression of osteoarthritis. This is the only product that has been shown to arrest the development of osteoarthritis. So again, using it earlier in the course of disease is better, but I use it even if I have an end-stage joint. Let's say I have end-stage left elbow osteoarthritis. Well, I still use it because maybe that elbow's end stage, but there's a lot of other joints that are going to be being overused because the dog is shifting its weight around and compensating for the pain in that left elbow. So I still use it for end stage, even if they have one really bad joint. What the benefit of this product is, it's given subcutaneously or intramuscularly. So it doesn't go right into the joint. It's just an injection under the skin, and it treats all of the joints. So it's, in my opinion, it is one of the very foundational things that osteoarthritic patients should be on. Okay, nutraceuticals. So nutraceuticals, kind of a big can of worms, honestly. The thing that you all need to know about nutraceuticals is they are not regulated in any way by a government agency. A nutraceutical basically is any non-toxic food component that has alleged health benefits. They are usually considered over the counter, but some do have medical claims, and if that's true, then it's more considered to be a drug. Not regulated by the FDA. So what we're basically doing is we're trusting the manufacturer to be truthful about what's in the bottle. And so what we'll go through some different nutraceuticals, but I provided you a list that, again, like when we talked about how to pick good pet food, when it comes to how to choose a good nutraceutical or oral supplement, these are questions you can ask. And this list of questions is exactly what I copy and paste and send to, if I have a client that says, hey, have you ever heard of supplement X? And oftentimes I have not, because there's so many out there on the market. Then I will say, you know what, I haven't heard about that, but let me check into it. So I'll just copy and paste this list of questions and I send it off. And what I find is I either never get a response, or if I do, they just send me back to their web page, and usually it doesn't have these answers. So unfortunately, many nutraceuticals do not meet some of these standards, and I can't really recommend them. So here are the questions. Do you have a product label with quantification of the active ingredients? So, how much of the active ingredients are in each bottle? Sometimes the labels they might say, oh, it includes this, but it doesn't say how much there is in it. 2, do you guarantee that the product label is consistent with what is in the bottle? So there was a study done that looked at supplements, and a large majority of supplements don't have what they say they have in the bottle, meaning there may be nothing, may have one ingredient that's not in that supplement at all. They may be way too highly concentrated, or it may be very minimally present. So this is a problem when you are dealing with unregulated supplements, that they oftentimes don't actually have what they say they have in them. The question number 3, have you had a product analysis performed on your product, including the raw materials as well as the finished product? Again, can you guarantee that it is what you say it is? Number 4, do you follow good manufacturing practices? So that's the little symbol that I put over here. That is a kind of like the AFCO. It's got some guidelines on how to manufacture these nutraceuticals, and it is helpful. If you see this label on your product, then that gives you a little bit of assurance that they are trying to exceed just being able to produce a product. Number 5, do you have any safety studies with your product? So that's really important to know that this supplement you're giving your pet is safe. So like pharmacokinetics, looking at how the product is metabolized, looking to make sure that it doesn't affect the liver or the kidneys, the main organs that have to metabolize these products. So that's a good thing to know. Number 6 is, do you have any toxicity studies? So like purposely overdosing a dog and looking to see what happens. Again, these are studies that are done all of the time in when drugs are being evaluated to bring to market. But with regards to these unregulated nutraceuticals, doesn't happen very often. And number 7, again, can you prove clinical efficacy? So I have clinical trials been done to prove that this product does what you say it does. The ideal type of a clinical trial is a prospective, randomized, double-blinded clinical trial on live dogs, which that's expensive and takes time, and many of these manufacturers don't have the capability to do that, or the knowledge to do that, and so they just don't. What they do is they say, hey, our product has these ingredients which have been shown in a laboratory setting to have these effects on cells. So, a petri dish lab setting versus in a live dog. And those just aren't the same. You can't compare a clinical trial with a petri dish. And that's something that you want to consider when you're looking at choosing a good supplement. So there's tons of nutraceuticals. I could be here another 10 hours talking about different nutraceuticals. What I did was I kind of put, based on data, kind of the comfort level on what I would recommend, and the different products that are out there. So I feel totally comfortable recommending omega-3 fatty acids. Omega-3 fatty acids have had many studies done, whether it be as a single supplement or a diet enriched with omega-3 fatty acids. And what what we know is omega-3 fatty acids act as a natural anti-inflammatory. So they help to block that cascade reaction that NSAIDs also help to block. And they can reduce pain and inflammation. There have been studies done looking at pets on foods that are enriched with omega-3 fatty acids. Their lameness is better. They bear more weight on these joints that have arthritis. So there have been prospective, randomized, double-blinded trials done with omega-3 fatty acids, and they work. They really do work. So your choices are either giving a capsule or an oral liquid of an omega-3 fatty acid. I like Nordic Naturals. There's, I'm sure, other good brands, but that's the brand that I typically recommend. They just have good quality control. They have sustainable fish sources, and they're just really nice people. And so I really like that particular brand. What when it comes to diet, there's different prescription diets out there that are enriched with omega-3 fatty acids. So if you were to give the supplement, not in the diet, but if you were just to give like a capsule or a liquid, basically, what I do is look at the labeled dose and take that, start them off at that dose, and then gradually increase it to about double that dose to get an anti-inflammatory level. You just don't want to go too quick. If you give too much omega-3 fatty acids too quickly, the dog will get diarrhea and you'll be very upset at me. So please don't give it too fast if you decide to do this. And obviously talk to your veterinarian about it. It's not a prescription, but your vet needs to know about it because there can be some drug interactions that if your pet's like on a blood thinner or something like that, you don't want to have them on omega-3 fatty acid. But out of all of the nutraceuticals, it is the one that I recommend most commonly. So then the next comfort level, my moderate comfort level, are a few options. So green-lipped mussels. Green-lipped mussels are mussels that live in the coastal waters of New Zealand. And what we know is that they have high amounts of omega-3 fatty acids in them, and they also have glucosamine in them. And they can provide pain relief and improved weight bearing. There are some studies out there that show that they help. They won't hurt a dog, and this particular product is in a variety of joint supplements. So I think that these are a good option as a secondary option. Additionally, this UC2, which is UC stands for undenatured collagen, and basically it's like chicken cartilage that has been that's the active ingredient. And the way that it works is, what we think happens is when a dog has arthritis and the joint becomes inflamed, there are little bits of collagen that gets released into the joint from that damaged cartilage. And that actually induces an immune system response and causes actually more inflammation. And then it kind of becomes this vicious cycle. And this UC2, when the dog takes it orally, it actually gets absorbed by the GI tract and causes an immune reaction in the body to reduce the dog's reaction to the collagen. So it blocks the dog's reaction to the collagen and thus slows down that vicious cycle and relieves pain. And there have been several studies with this product. There's several different supplements that have UC2 in it. And as a side note, my husband's taking this and really feels like it's helping him. So it's a product that I would be open to using and have used. Glucosamine chondroitin. So there are tons of products out there with glucosamine chondroitin in it. There's foods with glucosamine chondroitin in it. And the long story short, there's conflicting data. Some data shows that it's helpful. Other data shows that it does nothing. And that's true on the human side as well. And so my opinion is it's not going to hurt the dog. I can't tell you 100% that it's going to help. So I tell clients, if you're going to choose where to put your money, I would put it more towards omega-3 fatty acids, UC2, green lip mussel. I don't usually recommend glucosamine chondroitin. because I just don't feel like there's data to prove that it does what it says it does. And then when it comes to turmeric, that's kind of a newer product out there. It's not new. It's an ancient spice that has been used for a long time. And again, in vitro, so in a laboratory, in a petri dish, it shows that it has anti-inflammatory effects, which is good. You want that when you have osteoarthritis. But clinical studies have been done, and they actually show no improvement with what's called ground reaction forces. So if we walk a dog across a force plate, which tells us how much weight they're placing on a limb, if they're painful, they're going to not place as much weight on that limb. And there's no improvement when they give a dog turmeric and then walk them across that force plate again. There's no improvement. So there's no clinical evidence that it produces pain relief. So it's not something I'm going to recommend. Okay, next thing, exercise. Very important component to keeping our pets healthy. This chart was produced by a colleague and friend, Dr. Chris Zink, who, if you've been in the sporting world, you probably have heard of her. She's amazing. She's so smart, and she allowed me to use this chart as part of my presentation, and I really appreciate that. What this is this looks at fitness guidelines for puppies as they get older. And what we want to do is provide appropriate exercise based on the pet's age and where they are in their development. And by that, I mean not only physical, but mental. So there is what she calls good for the soul activities, which would be like off-leash adventure walks that she really recommends for all ages of dogs. So just keep that in mind. But if you have a puppy that's, a really young puppy, 3 to 7 weeks of age, really the thing you're going to be most focusing on is their balance and proprioception. So you've seen puppies when they're walking around, they look a little wobbly. That's something they need to work on. And if you can help with that, it's definitely beneficial. Proprioception is a term that we use basically for the brain's awareness of where the feet are in space. So puppies that are clumsy and stumble and fall and trip over their own feet, oftentimes it's because those connections aren't quite, aren't very sharp. And so that proprioception is reduced, and they tend to be a little bit more clumsy. So really for a young puppy, that's about all you want to focus on. You don't need to be doing, major, physical workouts on a young puppy. Now, as they get a little older, between 8 weeks to 6 months, then you can start to work on some flexibility and stretching. So not so much with you stretching your dog, but figuring out ways to teach them to stretch their own muscles. So what we call active stretching. So, using some treats or clicker training, whatever way that you prefer to train your dog, you can work on, getting them to stretch, say, their iliopsoas, which is a muscle that is what's called a hip flexor muscle that commonly gets injured in dogs that do activities where they do hyperextension of their lumbar and hips. So like dock diving dogs can get iliopsoas strains, or agility dogs can get that. So if you could teach a puppy how to stretch that muscle when they're young, and then as they get older, that just is part of your routine, then that would be helpful. Once they get 6 months and to the point that they have their growth plates closed, and as we talked about, the larger the dog, the longer that takes, we just kind of focus on strength training. We don't want to do major endurance training until after those growth plates have closed. And the whole theory behind that is, again, large breed dogs have more susceptibility to damage to those growth plates if they do activity that's too strenuous. So avoiding things like repetitive concussive exercise until those growth plates are closed is really recommended. So, what is an appropriate exercise for puppies? There's some recommendations of only allowing 5 minutes of exercise per month of age. So if you have a 2-month-old puppy, they can only get 10 minutes of exercise per day, which seems awful low to me. I think that they should be able to have more exercise than that. But again, the big thing that we are looking at is avoiding jarring, high intensity concussive activities, mainly because we don't want to cause some type of trauma to whether it be the articular surface of the joint or those growth plates themselves. Now, when it comes to exercise for adults or athletes or working dogs or geriatric dogs, that it kind of just depends on what they do and where they're at in their life stage and what their activity level is. We know that if you have a performance dog, that you should do a warm up and a cool down. That improves performance. It's recommended that you focus on training specific muscle groups twice a week and then switch. So, like if you train the pelvic limbs on Monday, and then you want to give now those muscle groups at least 72 hours of rest before you try to work those muscles out again. So Monday you do pelvic limbs, Tuesday you do thoracic limbs, Wednesday you do core, and then on Thursday you go back to the pelvic limbs. So the thought is you give breaks to allow for recovery. You also want to have some days where you don't really do much of anything. You want to give the dog a rest because you don't want to overcondition the dog. That can cause other problems metabolically, and just their ability to perform will go down if they're overconditioned. When you are exercising your dog, you want to look for signs of fatigue. So what does that look like? Well, if you have a dog who can maintain a good body posture, have it, be standing up straight and maintain their balance and hold a position for a period of time, but then you start to notice that they are sinking kind of in their back end or shifting their weight around or just deciding to sit, that means they're getting tired, and you need to maybe take a break or reduce the intensity. If you're starting a new program, you want to gradually increase your duration, gradually increase your repetitions, and gradually increase your intensity of exercise. Just like if you were to start out at the gym, if maybe you haven't worked out for 5 years and now you are wanting to get back into shape, you wouldn't start off by running 5 miles. You would start off by walking maybe a quarter of a mile and then gradually adding to that, and then starting with a slow run and then working your way up to it. And we know that exercise is so important for dogs. It helps mentally. It helps them stay engaged in their surroundings. It makes them happy. It actually can. We know that exercise can actually relieve pain, and so especially older dogs, keeping them active can improve their quality of life and actually extend their life expectancy. But with older dogs, we know we want to do fewer reps and give them more breaks, allow them to have more rest periods. So here is just an example of strength training and endurance. So, it really kind of depends on maybe what your pet, if they compete, where they need to be stronger. Although I would recommend doing a balanced strengthening program. You don't want to just strengthen the forelimbs or the thoracic limbs and ignore the legs, the hind limbs. And if we were to add in some endurance, it's usually recommended to do like 2 to 3 20-minute jogs per week, or you could do 2 jogs and then add in maybe a longer hike on the weekend if you've got more time. Hiking is an excellent activity because it's, the terrain varies. There's inclines, declines. They have to step over things. So it improves proprioception, or the brain's awareness of where the feet are. It's great for a whole body workout. So if you happen to live in an area where you can take your dog hiking, I think that's great. And then don't forget the good for the soul activities. So like I mentioned earlier, allowing your dog to, be off leash and be able to explore the world and stimulate their minds. So now rehabilitation, which is what I do. If you have a pet that is having osteoarthritis, or they've had surgery, or they've got some type of an injury, That's when you get somebody who really understands the tissue healing process and knows how to formulate a exercise plan to really improve the dog's mobility, quality of life. If you have a dog that's a competitor, um, folks that do sports medicine can help, formulate a exercise plan, a warm up plan, a cool down plan. They can be really invaluable to you for that type of activity. So please utilize, if you have a rehabilitation therapist in your area, utilize them because they can really help. So what we do is, targeted therapeutic exercises. So let's say I've had a dog that's got hip dysplasia and they have severe atrophy of the gluteal muscles that support the hip. We're going to target our exercise to strengthen those particular muscles. We'll do a full body workout, but we're going to really work on, focusing on the muscles that are having troubles. And when it comes to formulating a plan, we always want to take into consideration, there's 4 components so that we have a balanced exercise plan. We always want to we want to add some strength, we want to add endurance, we want to improve proprioception, and we want to help with balance. So those are the big components. In my rehab gym, I do have an underwater treadmill. There's lots of benefits to water therapy. The water is warm, so it's soothing to the achy joints, achy sore muscles. The water provides buoyancy, so it takes some of the weight off of these sore joints. It allows us to have the dog walk through water. And if you think about it, when you just walk across the ground, you have one range of motion in your joints. But when you walk through water, it's a much more exaggerated range of motion. And that is really helpful for dogs who have, stiff joints to have to kind of walk with that exaggerated range of motion. Walking against water flow also provides some resistance, which will help with cardiovascular and endurance levels. So lots of benefits to underwater treadmill. We also have a large variety of modalities that relieve pain, such as photobiomodulation, which is a fancy word for laser, shockwave, which is actually using high energy of ultrasound wave to induce healing. Let me go back to laser. I just skipped over it like everybody knows what it is. It's such a common modality that I would assume a lot of you have heard about it. But basically what it is using a very specific wavelength of light directed to tissue that has been found to improve cellular metabolism. So just like the sun shines down on grass and allows it to grow, laser is using a light wave that has been shown to make cells in bodies work better. And so it's been shown to help reduce pain, inflammation, improve healing. And there's a lot of information about laser out there. A lot of veterinary clinics have it. I think the biggest thing about using laser is knowing proper anatomy and where to direct that light source. Sometimes I get a little worried that the people that have these units in their hand may not know exactly where they should point the laser, but that every clinic is going to be a little bit different. But very common and has data to back up its claims on using this for pain management. Acupuncture. So acupuncture works by placing very small needles into the body in various places that have been shown to reduce pain. Typically, it correlates with nerves that innervate the painful areas. And, I was trained in the traditional Chinese medicine perspective, which is anytime there's any sort of a malady that the pet is dealing with, it's because something is out of balance. And so acupuncture is designed to bring the body back to homeostasis or bring it back to balance so that it can then function at its optimal level and not be painful. So I use acupuncture quite often. I use it a lot more in my senior pets, and I use it a lot more in pets who can't tolerate oral medications, or maybe the owner just chooses not to use drugs. They'd rather go along a more holistic option. NMES is neuromuscular stimulation. So we'll use that if we've got like a pet who's got severe muscle atrophy. We have these little pads that we'll place on the muscle to stimulate it to contract. And Also, PEMF is using pulse electromagnetic field therapy. That is using magnetic waves to basically induce the cells to work better and relieve pain. Finally, in rehabilitation, we have soft tissue mobilization, which is similar to massage. We do trigger point therapy, and we do manual therapy. So there's a lot that goes into rehabilitation. So if you have somebody in your area that provides these services and your pet's having any mobility issues, I would definitely seek them out. This just shows kind of how we progress a pet in therapeutic exercises. So basically, everything is based on the pet's pain level, first of all, but also how strong are they and how much weight are they bearing. And that helps us decide what level of intensity do we exercise that particular pet. And then it also helps us decide, if they've mastered being able to stand with one leg up on the floor, then we want to make it a little harder and put their front feet up. So now they're putting more weight back here on those pelvic limbs. And then to make that a little harder still, we pick up this right pelvic limb, and now they're bearing quite a bit more weight on that left pelvic limb. So that's just one example of how we progress our exercises. Finally, last topic is weight management. And, what we know is it's so vital that you keep your dog lean. It's important because we know that dogs are, if they are 15 to 20% above their ideal body weight, so if their body condition score is greater than 6.5 or 7, they're considered obese. And, just the sheer mass of having that extra weight increases the force that's placed on these already painful joints. And the other thing that we know is that abdominal fat or adipose tissue is actually metabolically active, meaning that it actually acts as an endocrine organ. It produces pro-inflammatory hormones that go to the joints and actually increase the progression of osteoarthritis. So there are studies that have been done that show that just reducing the pet's weight by even just 6 to 8% shows a decrease in pelvic limb lameness. So even a pretty mild weight loss can reduce pelvic limb lameness. So that's pretty encouraging, because that is something that pet owners definitely have an ability to make a change. And it's, all we're doing is looking at the food and adjusting calories. There are prescription strength weight loss diets out there. I typically tell owners, let's not change their food at the beginning. Let's just look at what you're feeding, not just food, but also treats, any other things that they get throughout the day. Let's look at how many calories they're getting per day. And then what I do is I figure out how many calories they should have based on their resting energy requirements, like we talked about earlier. I figure out how many calories they should have to get to their ideal body weight, which would be a body condition score of 5 at least. And then we slowly just cut back on the calories. You don't want to underfeed calories so much that it basically shuts their metabolism down. So we do it kind of slow, and we watch to see, how the pet does. And if they don't have, consistent weight loss, and I don't want it to be fast, I want it to be slow but consistent. If they don't have consistent weight loss, then we can talk about looking at a prescription weight loss formula. Now, again, why is this so important? There was a study done by Purina back in 2002, so it's been around for quite a while, and maybe you've heard about it, but they looked at they call it the lifetime study, and what they did was they had 48 lab puppies, and they followed them through their whole life. They fed them all the same food. It was a all life stage food. Excuse me. So if you remember, that's the food that's formulated for a puppy and a nursing dog. So it's pretty high energy density. And out of those 48 puppies, half were fed whatever they could eat in 15 minutes. So it was basically a free for all for 15 minutes. And then the other half got 25% of whatever the first group ate. They were called the lean group. Okay, so the lean group as they followed them through life, what they found was that on average, they lived 1.8 years longer. I mean, that's almost 2 years longer just by feeding your pet 25% less food. They also aged better. They had less muscle atrophy. Even their gray hair, their graying of the muzzle came on later in life. And when they got arthritis, it was much later in life. And they didn't show, their clinical symptoms were not as severe. So they took x-rays of the dogs that were fed 25% less. And well, they took x-rays of both categories. And what they found was the dogs that were limited in their feeding, they developed radiographic signs of osteoarthritis at 12 years. And the dogs that were allowed to eat as much as they could in that 15-minute period developed osteoarthritis at 6 years of age. So if that doesn't tell you to just feed an appropriate amount, I don't know what will. And this weight control, weight loss is one of the big components that I talk to my clients about, because again, this is something that we have complete control over. And, the dogs typically open the refrigerator by themselves and get extra food. They are dependent on what we provide. So if you, can really look at, have your veterinarian help you, but figure out a good body condition score for your pet, figure out how many calories they should have. If they're overweight, figure out, what a good goal weight would be for them. And then slowly cut your calories back. It will extend your dog's life. It will improve their mobility. It will reduce the risk of other diseases like cancer and diabetes and cardiovascular disease. And it will improve their quality of life. And it is so important that, again, I recommend it for any dog that's overweight to get lean, and any dog that is lean to stay lean. Okay, I hope I covered the topics that you wanted. I know that y'all will have great questions for me, and I'm happy to answer those for you the best that I can. If I don't have an answer for you right away, I can definitely email, and we can, extend this conversation further if need be. But I really appreciate your time and attention, and I hope you have a great rest of your day. Thank you.